If you are a parent, do you know what to do when your child has bronchiolitis? Do you know what the symptoms of bronchiolitis are? I'm Dr. Williams. I am a board certified pediatrician and I'm a father of 5 of my own. You might hit follow if you'd like to keep seeing evidence-based tips to help you raise healthy and happy kids. Let's go over how to best help your child with bronchiolitis, as well as a few dangerous signs that would say you need to take your child to the doctor immediately. Bronchiolitis is the worst. It can be caused by any old virus under the sun, but it tends to be caused by a virus called RSV. And it can cause a whole host of symptoms that are bothersome, but the two that I'd worry about the most is it can get in the way of eating and it can cause some respiratory distress. Bronchioles are small little bits of your child's airways where you start to exchange oxygen and carbon dioxide, okay? And it's this little membrane where you've got oxygen over here and carbon dioxide over here, and these two are trying to trade places. Itis just means swelling, so you can see if that bronchiole starts to swell and you're trying to exchange oxygen and carbon dioxide, you're going to have a problem if that membrane is thicker. And the bad news kind of keeps coming. We don't have a lot of great treatment options for bronchiolitis, especially if your kid is under a year old. It feels like we just keep trying different medications and they're just not working. We've tried albuterol, we've tried Heliox, we've tried steroids, but really there's just not a lot of medicines that will help your child with bronchiolitis. Your best bets for home remedies for bronchiolitis are things like nasal saline sprays, nasal suctioning, a humidifier, and small, frequent feed. If your child develops a fever, or if they're not feeding very well, or if they're having any signs that look like they're having a hard time breathing, those are all times where you need to be seen by a doctor pronto. It's been a terrible year for bronchiolitis. Honestly, I've probably had more patients this year get admitted to the hospital than I ever have before. It's just a terrible disease.